So today we're talking about birth trauma of foals, girth pain, poor posture and asymmetry of adult horses. I hope you find this very interesting. I'm Ian Bitstrup, a veterinarian who's focused on treating spinal pain of horses for the last 30 or more years. Exploring birth trauma of foals and the link between birth trauma, girth pain, wither pain, poor posture and asymmetry of horses has been one of my passions for over 25 years. I've explored these issues via keeping careful records in a dedicated spinal practice, via scientific research into birth trauma, spinal dysfunction, spinal pathology and ligamental strain. This explanation has given me hugely valuable insights that have allowed me to be much more effective in treating spinal pain, performance and behavioural problems of horses. I want you, whether you're a veterinarian or horse therapist, a saddle fitter or simply a rider, to benefit from the knowledge I've been lucky enough to gain. Today we're going to connect the dots for you, starting first with looking at what we know about birth trauma. So when most people think about birth trauma in foals, they think about foals landing heavily like this one after a standing birth and getting damaged in the process, or perhaps awkwardly like this one that lands pretty much on its head into a nasty position, or perhaps a little bit like this one after the foal's hips getting locked in the pelvis. Finally it's let loose and hits the floor in a very awkward way. As most of us are aware, mares usually foal lying down. So in this video I will walk you through what's happening with the foal as it is transiting the birth canal. This is a young mare having its first foal. She's already done a lot of work to get the foal's head, neck and right foreleg out this far. In this case the left foreleg is still back a little, as it seems is more commonly the case in foal birth. The mare has managed to get the right shoulder partially through, but is struggling to get the left one clear of the inside of the pelvis. And we have the common situation of a bit of a shoulder lock. In this position, the foal's chest is feeling huge compressive force exerted on via the foal's shoulders, and particularly via the left shoulder. Once that left shoulder is through, there's a lot of pressure taken off the chest, but there's still a great deal of a constrictive band, if you like, around the girth area of the foal at this stage. Luckily, the birth canal has expanded a great deal at this stage, and so things are getting a little bit easier on the foal as the birth passage is actually better prepared for things to come. So the chest should come out pretty readily now, as it does. And then the hips are next. Often the hips will lock, but in this case the foal's hips don't lock, thank goodness, and it's able to get out more easily as a result. And thus we end up with the fascinating event of birth, of new life, which is always wonderful to see. As you can see on the right, there's a lot of foal to come out of what is a fairly small escape hatch. And yet us horse owners and riders rarely link the fact that something so big has got to get out of something so small, and consider that escaping must have led to a considerable amount of damage to the foal, to say nothing of the mare. How much room is in the birth canal? Well, even without a foal in there, there's not a lot. If you put your arm in there, like most veterinarians, stud veterinarians like I was for 10 years, you know that it's a pretty tight space in a normal mare that isn't having a foal. There's a lot of different tissue from the rectum, the vagina, pelvic muscles, supportive connective tissues, blood vessels, nerves, and varying degrees of fat. And if there's a lot of fat, it makes it extra hard. It's a tight enough space. even without a foal there. And if the foal was only double the size of my arm in diameter, it would still have a fair bit of trouble getting out of there. The circumference of a thoroughbred's chest is about 90 centimetres, so it's a big amount to get out. What do we know about research into thoracic trauma and the recognition of it? Back in as long ago as the 1930s, there were reports of foals getting quite considerable trauma to their rib cage, and that was followed by a number of research papers, including those on calves. In 1997, there was one on fractured ribs in neonatal foals that really brought ahead, I think, the research that was done and reported on in 1999 in the Equine Veterinary Journal by Daniel Jean and his colleagues. This was one of the first major papers into thoracic birth trauma. The study involved 263 foals over their first week of life, and most of them within 3 days of birth. The location was in a high-quality thoroughbred stud in Ireland, so things were all pretty smick there. What they found with the foals was when they examined them by palpation and turning them on their back and examining them that way, that 20% had thoracic cage asymmetry, and it was attributed to rib fractures or partial dislocation of the rib-sternum junction, or the costochondral junction. The research findings showed that about 5% of, if you consider the whole group, had fractured ribs, if you work it out as a percentage on what they picked up. And these were detected by a basic X-ray system in a field situation where the foals are awake and moving around, and foals can be a little bit tricky to get in the right position to take a decent X-ray, even in a university. So they did well to pick up that many. The conclusion that they made was that rib fractures and other thoracic trauma are likely to be present in a significant number of newborn foals as a result of the damage that occurs during their transit through the birth canal. A conclusion that is really quite consistent with previous practitioner observations and research. More foal fractures were seen in first foal mares, those where the foal was premature and thus easily squashed and damaged, and those where births were assisted. They also commented that the foals in this study with rib fractures actually seemed clinically normal, like they were getting around as though there was nothing going wrong. That makes me wonder how many of our own foals over the years have gone unrecognised as having quite a considerable amount of damage to their ribs. Certainly fracture calluses at the rib ends are readily found when you palpate older foals, and there's tenderness around them, even in older foals. So right at the end of the ribs, there's quite big lumps or knobs that are actually consistent with being calluses from fractures. In humans, fractures are recorded in a much lower percentage than was seen in this research. It's only 1 or 2% that it's observed that. Fractures of the collarbone occur, fractures of the rib. A lot of the time I imagine they're not x-rayed and it's not picked up, because it's well recognised even in adult humans that fractures are commonly missed after considerable trauma, and it's not until later on that they show up when calluses are forming. The research into infant damage with rib fractures suggests that they're particularly associated with one shoulder getting locked up against the mother's pelvis. So when the baby's coming out, the shoulder gets caught on the pelvis and they have trouble getting through. And if you're a mother of children that have had a normal birth, you know all about this, I'm sure. Shoulder lock is a common event for foal births, as you saw in the video of the mare lying down. In the case of babies, the researchers noted that with shoulder lock or dystocias, there was relative fixation of one side of the chest during labour. It actually got sort of jammed up. And what happens, I believe, is this provided mechanical advantage to the other side, allowing half the rib cage to actually, or that half of the rib cage to actually concertina out and mould better into the confined space of the birth canal, while the lock side is held more rigidly and thus more prone to cracking under the forces in the birth canal. Indeed, this rib bracing was believed to contribute to this asymmetrical fracture pattern, something found in most babies in birth-related rib fractures. The same group did further research, this time looking at retrospective post-mortem studies. They looked at the 10 years between 1990 and 2000. They looked at a lot of foals and looked at the records and found that 9% of those had died as considered from major thoracic trauma. And 94% of that group had major damage to the joint here, the costochondral junction. And the fractures occurred mainly between T3 and TA, or T3 and T7. And the interesting thing too is, like with babies, the fractures were more on one side than the other, and they were usually on the left side, was the predominant side to be affected. They show that the number that occur gets greater as the width of the sternum, from the bottom of the sternum to the back or the top of the wither. The closer you got to the top of the wither, the greater the number of fractures. And this is really interesting because it corresponds to what we see in practice with pain associated with birth trauma. And we'll talk about that more later on. The same group again took their research further and did a check on the system as far as how many do you pick up with X-ray and how many do you pick up with ultrasound, and are they much the same? And what they found was really interesting. So they looked at 29 foals that came into the university situation, so they were a much better situation for X-rays than that out on the farm, the stud farm. And what they found was really important, I think. They found that the X-ray missed at least 80% of the rib fractures. So if we go back to that 1999 study, that translates to about 20% of the foals with rib fractures, not just 5%. So this is real evidence that this is a major drama in foals. This is something happening. If you've got that much damage to the ribs, what other damage is going on? Their conclusions and other findings were that the housing of horses, as in keeping them in stalls for foal birth, the close observation of them and the assisted delivery contribute to the birth trauma. This is consistent with some terrible stats from calving down cows in stalls and so forth, where they're much more likely to have birth trauma than if they're out in the field. And it's something to really ponder on for us as to whether we should be boxing our mares and watching them so much. And also we've got to be more careful with our delivery of the foals. If we're going to help the mare or help the foal to deliver, we've really got to consider what pressure we're putting the foal under and also what damage we're doing to the mare. They noted in their research that even foals with severely fractured ribs that were in these neonatal intensive care units acted pretty normally within 2 days of birth. So rib fractures are not likely to be picked up in a farm or a home situation in most cases, and I think this is consistent with what we see. The location of rib fractures they found was quite similar to that of the 2003 paper, and they were concentrated from T3 to T7. Again, the highest part, or the biggest distance from the bottom of the sternum to the top of the wither, and also where the shoulder sits over the foal when it's coming through the birth canal. Summary of this is that a considerable portion of foals do get injuries during birth, as we should really expect when we look at the foal videos and think about what we've seen with foalings. There seems to be a bias of injuries with the lower left rib cage showing the greatest portion of rib fractures. So this is an asymmetry that happens right at birth. And perhaps it needs more attention for that reason. The damage is mainly from the sternal ribs, from the 3rd to the 7th rib. So what the research papers haven't discussed, though, is what else is happening to the foal when it's coming out, or its chest at least, is coming out through the birth canal. Sure, there's rib cage fractures there, but what other impacts? If you have major impacts on your body here, then it's not, and you're getting squashed in a pipe, so to speak, then you're going to get other things happening. So what's happening on the opposite side? What's happening to the spine, for instance? We'll talk about that in a second. If you've got a horse with high heel, low heel syndrome and other signs of asymmetry, one that's particularly girthy or seems prone to stomach ulcers despite all you do, then perhaps you should be interested in the rest of the presentation. And for that matter, there are other things you should really be considering. If you're a breeder, you may want to consider that your newborn foal could be at risk of a punctured lung from rib fractures, that they're actually jagged and can cut into the lung or into the heart and cause the foal to die from that reason, or be so sore that they need some pain relief for the foal to be able to suckle or drink from its mother with comfort. And there's plenty of foals that have needed that over time, that are in practice that I've seen, that have needed some help to get them to be comfortable to suckle from their mother. Otherwise, they just can't get up under them and get onto the udder and get going. For those that don't breed, most would think, well, there are fractures in ribs and distorted chests of foals, but they're going to heal. I've had a rib fracture, they'd probably say, and that's healed. Like it was sore for quite a long time, but it healed and I was fine. You would consider that it shouldn't be an issue with an adult horse. Well, sadly, this is not supported by what I've found through 30 years of spinal practice, and particularly the last 25 years where we've really looked at this issue. If we consider the way the newborn foal's brain learns, the pain and stiffness of the spine found in foals, and the potential for this to set up horses for lifelong problems, then this finding is huge. And we'll get into all of this if you hang around long enough. So birth trauma, it actually has a diagonal impact on the foal's body, and we'll just run you through why that is the case. The birth canal itself is not just a nice neat circle, it's actually more of an oval with a situation where the foal has to get either side of the bottom of the croup or the sacrum here to get out. So it's going to come out that way or that way, but needs the whole width of it. So as a result, the foal has to swing into one or the other diagonal of the pelvis. On the left diagonal, the foal's left shoulder gets somewhat caught behind the enlargement of the wing of the pelvis. The ilium is this portion of the pelvis, and that is there to support the hip joint of the mare. It's a reinforced part of the bone, but it actually is a bit of a stopping point when you're getting a foal, or when the foal has to get out here. And the foal's shoulder can get caught behind that bit of bone to a minor or a major degree. During left shoulder lock against the lower wing of the mother's pelvis, the foal's rib cage is likely to be held more rigidly as recognised in babies. So this part here and this part here are forced together and held as a rigid bit and suffer greater force than any other part of the rib cage, and thus this rib is more likely to fracture. This lower side rib is more likely to fracture than the upper side rib. So in this diagonal with the upper chest, in this area here, the shoulder is lying over the top of it as well, so impacting on the spine in that area. The spine is going to suffer quite a lot of pressure, and with the rib cage potentially concertinaed out, unlike the jammed up left side on the lower side, then the spine itself is potentially very vulnerable. it's going to be in a less supported state from the ribs itself, and thus more vulnerable to be damaged by the intrapelvic pressure. It is damage to the spine under the shoulder blade, I believe, that's the missing link in the understanding of common wither pain and girth pain. And we'll talk more about this highly important issue later on in the presentation if you keep around. So the essentials of birth is that it actually happens diagonally. The upper leg is more forward and got more pressure from the shoulder blade on the spine. The lower leg, to a degree, is caught behind the walls of the pelvis and is more rigidly jammed up and thus more likely to be traumatized on that side. We've mainly talked about the left diagonal, and that's for good reason, because it's the one that appears most frequently used by foals. And so this is a sign of asymmetry that happens very early in the foal's life. The predilection for the left diagonal is backed up by anecdotal evidence from professional foal watch on studs. I've heard this repeatedly through so many foal watch personnel, that the right foreleg is the most commonly presented first. They come out either way, but the right is the more common one. And I did a study actually in 2015, that I haven't actually published yet, but it was a study of 50 online foal births that I observed on YouTube and video, and to the best of my ability, what came out of that was that 70% of the foals were seen to be delivering with their right foreleg ahead of the left foreleg. The left diagonal potentially places the right side of the spinal column under the greatest amount of damaging pressure, and this fits in with what we see in asymmetry of spinal pain that we'll come back to later on. I wanted to highlight the issue about the majority of newborn foals appearing unaffected. So the findings of the 1999 paper included that the foals with chest and rib damage seemed quite normal in their activity. And likewise, even after a couple of days or so, the foals that had really bad fractures in the neonatal intensive care units seemed to get around pretty well after a few days. They mightn't have been as hunky-dory as the other ones, but they were going much better. Then they were getting around pretty well, rather, and you wouldn't have thought they were so damaged. For anyone who's suffered fractured ribs, even cracked ribs, this would have to seem amazing, because for us, that's a really painful thing, and you don't want to move your spine, you don't want to do anything much to upset those ribs. With foals, things are a bit different. We've got to consider that they're nomadic animals and they have to run or die. We have to keep in mind that in an evolutionary sense, the foals can't afford to take notice of a pain occurring as a result of birth. As nomadic animals, they have to be ready to travel with a herd the morning after the night of birth, or be left behind at the mercy of their predators. So we shouldn't be surprised that seeing foals behaving like any other, even after considerable birth trauma. And if you consider that humans can take a year or so to walk from being born, and we're slugs for quite a while, and then we start crawling, and then we get walking, and then running down the track. Foals take an hour or so before they're walking and running around. They have to do so to survive. They have to get moving. Thus, the foal's brain has got to adapt very quickly from the foal moving very little in the uterus to it running around the outside world. To get up and running, the foal has to learn how to use its brain connections with lightning speed. And this learning is occurring in a somewhat injured state, whether it's with nasty fractures or even lesser injury. It's got to be injured coming through that tight space in any case. But the brain is
can't afford to concentrate on pain and deal with that, or say, oh, don't move, you're too sore. It's got to ignore the pain, or in the wild the foal will die, and that won't allow its survival. We shouldn't be surprised that the brain of the foals must accept this injured state as normal if it's going to survive. And what appears to happen is that injured state becomes the new normal for the brain. The brain actually accepts that as the way things should be and remains as such in the absence of spinal rehabilitation. The problem for us horse riders and for the horses themselves is that the injured state is not functionally or neurologically normal, and it can make things really difficult for a horse to be ridden, but more on that shortly. So newborn foals are very sore on both sides of the chest when they're first born, not just one side. They've been crushed, and this is universal for all the foals I've treated. I've treated them from day old right through to 42 years of age is the oldest horse I've treated, with the same symptoms that I will talk about soon. By a month old, the foals are still showing soreness when you palpate their lower rib cage and wither, just less acute and more localised to the front of the chest and the lower part of the chest and the wither and the girth. By percentage, the rib cage tenderness is greater on the left lower side, and more tender calluses are found there, and they are quite obvious and tender for quite some time. On the right side, the muscular tenderness is greater in the girth and wither and down the back of the foreleg on the other side than it is on the left side. But they can be really sore still on both, and they can be affected just as badly on both. But there's a bias. An asymmetric 1 foot forward grazing pattern usually gets quite well established at this stage, such as we see here. And there's plenty of research being done on that, and we haven't got time to get into it today. But by 6 months of age, the soreness is more one-sided again, and the patterns of soreness are more confined to the wither and girth and back of the shoulder through the triceps muscles, the serratus ventralis, and the skin muscles. Unevenness of the front hooves may be becoming apparent even at that stage, and that tends to progress over time. One front leg may be more upright than the other, and there may be a bit of a difference in the turn of the forelegs or placement of the forelegs from the fetlock becoming apparent. Actually, we're not talking, what I mean is deviation of the fetlock in these ones. As foals develop into yearlings and eventually adults, common asymmetry in the form of high heel, low heel syndrome, canter lead preferences, stiffness of the neck bend, and all these things become more and more apparent. And clinical experience shows that spinal dysfunction found from birth, around birth, right through the first year of the foal's life, remains rather than disappears with time. Some would like to believe it disappears. It just abates. The dysfunction is still there. The spinal dysfunction, if not treated adequately, remains for life. So what is this spinal dysfunction? Well, this is going to be a bit heavy, so buckle in for a rough ride. Spinal dysfunction is a big topic in itself, and something we will explore later in a later presentation during the European autumn. But the basics of it are that the dysfunctional spinal vertebral segments are stiff and not moving correctly. And the theory is that the spine under the shoulder blades of the foals get quite squashed and undergoes injury in the birth canal, as we've discussed. This injury is likely to involve spinal joints and spinal ligaments. The body's response to spinal injury is to stiffen and brace the injured segments, in particular by tightening the spinal muscles. Such a response is common wherever the spinal column is injured. If you think about a human with a lower back injury, their back is as tight as a drum, and all the bracing and stiffness of the spine that occurs when this injury is acute, the body responds by just bracing it all, just like a twisted ankle gets braced. In an ideal state, the bracing spinal muscles are supposed to turn off when the brain is happy with that the spine has healed well enough. Well, usually that happens, at least in humans, and throughout life, spinal injuries heal within a few weeks, and a lot of time things free up again. If they last longer, then things can become a long-lasting problem. But that's another subject. The period immediately after birth of the foal is quite different. As we've discussed, the survival, the necessity to ignore pain to survive is likely to make it necessary for the brain to accept how the spine is set immediately after birth. The problem is that the tight and bracing spinal muscles are accepted as being the new normal and left tight even after the injury has resolved, leaving the spine perpetually stiffened in its motion or dysfunctional. Normally with the average spinal injury, once it's healed, a sudden, more extending movement will get the spine moving freely again, such as a horse neck bending around very fast and rapidly when it turns to get rid of a fly. Such freeing movement naturally alerts the brain to the fact that the small spinal muscles are actually not quite set as they should be, that stretching of them and extra movement of or lengthening of them helps the brain to reprogram the settings for those small spinal muscles. And it helps to bring more balanced movement to the spinal segments. For that matter, necks that are always cracking usually do so because there is tension on the neck from the spinalis thoracic muscles, in my experience. Those muscles are the upper extension of the long back muscle, the longissimus. The tension that remains in that area repeatedly jams up and locks the lower neck. But that's another part of the deal. Getting the spine to free up naturally is particularly hard for the portion under the shoulder blades, as it is braced by both the sternal ribs and splintered by the shoulder blades in association with the shoulder muscles. Thus, it appears that the birth canal-induced spinal injury of that portion of the spine rarely resolves naturally and at best eases up, or at least seems to ease up. And this is where rehabilitation of the spinal motion is really so important. We'll talk more about that very shortly. To pursue this dysfunction issue more, the brain is monitoring the tensions in the small spinal muscles of the multifidus and other spinal muscles on a microsecond frequency and adjusting them to allow normal movement of the spine and also to protect the spine from over-moving. If we have maintained stiffening tension of the small spinal muscles, as is set up, it seems, at birth to protect the injured spinal column, then that will prevent normal movement of the vertebrae of the wither. Current research into spinal function suggests this maintained stiffness alters the environment for feedback from the spinal segments, each vertebrae lined up, together line up to form a spinal segment, and then they all piece together. It alters the environment for feedback from the spinal segments, including the spinal nerves, to the brain, resulting in a situation of what's called nerve signal facilitation. Such nerve facilitation is likely to be behind the abnormally reactive and tender wither and girth muscles. And we'll see that sort of dysfunction in a video very shortly. T4 syndrome is a spinal dysfunction that is seen in humans. It certainly has parallels to what we see in foals. It is associated with the upper thoracic spine of people, and it's mainly centered around the fourth thoracic vertebrae, and thus its name. One of the things it can produce is back and chest pain that mimics a heart attack. And sometimes it feels so severe for people that it's like they're getting a knife in the back. And perhaps this is something that should make us more sympathetic to poor horses that drop to the ground when they're girthed up, or go into a frantic round of bucking when the girth is applied to their chest. And perhaps they're feeling the same sort of knifing, nasty pain that a human is. And it would make sense when you see what these horses do. Let's look at this video of a 9-month-old quarter horse. This is a standout case of spinal dysfunction, but in my clinical practice, I find the majority of foals, weanlings, yearlings and adult horses show the same type of dysfunctional tightness and tenderness of the girth very frequently. It's just a matter of degree of how much they're affected.
And this is a 9-month-old quarter horse filly, and she's showing what's typical signs of birth trauma. And if we just touch her leg here, you can see how she's quite sensitive in this area. She's a little bit agitated at the moment. She's looking at herself in a mirror. Good girl. And if we just tap her leg, you can see that you can notice it just goes into spasm. And if we touch her down through the belly, it is really quite uncomfortable for her. And she's a little bit apprehensive because she's away from home. We'll see what happens when we change the mobility of her spine back to normal. Good girl. There's two main vertebrae that are not moving or rotating correctly at the moment. Good girl. And she's just done a lick and chew after that. Good girl. Still got some sensitivity here, but she's improved in her, or reduced in the sensitivity, but she's far from right yet.
This follow-up examination video shows clearly how different a horse can be with rehabilitation of its spinal function. I'm mindful that she may have been more irritated previously by being at the point of losing her coat, but the extreme nature of her sensitivity was still real. This case is not rare at all in my practice. We see extreme ones, we see very subtle ones that need good skill and knowledge to pick up on, but we see it with huge frequency. In this case, the issues that led the owner to be concerned about the filly had been happening for some time prior to the first examination, so it wasn't just about her losing her coat. From studying and treating cohorts of thoroughbred foals on studs and single foals of all breeds, what you've seen here with the 9-month-old quarter horse is just, as I was saying, a more extreme version of what is common in most foals when you know how to look. This lovely little girl we saw a few weeks ago, and she was very agitated through the foreleg and the girth area, and also through the wither. And we've got some irritation still apparent through the wither on this side. The triceps area and the girth are so much better than they were the last time. And the owner reports that she's been stepping out a lot better. She's been stepping out a lot better, and that she's been a lot nicer to handle. She's been happier girl. And this is looking at the offside, and through the wither she's actually better than she is on the near side, and the triceps once more are pretty happy in comparison to what they were. They were super reactive last time, and now they've got a little bit of reactivity, but they're much better than they were. The other report was about the farrier. When the farrier saw her last time, he could only do the front feet and had trouble with the back ones, whereas after the treatment, she's allowed him to do the front and back quite readily. So overall, a very nice change, and what we actually expect, a common change that we see in horses like this. Let's look at girth pain, poor posture and asymmetry of horses a bit more. We'll start by looking at a video. This horse is a good example of what I see every day in practice in thoroughbreds, and is a fairly graphic example of symptoms in the girth and wither that I feel is directly related to birth trauma. So the long head of the triceps here is very bouncy. You can see how just light tapping, and I'm hardly touching him here, is causing him to change his whole, it's causing him to change the whole leg. So that's all the passive stay apparatus is affected there, because this is all part of the stay apparatus. Now down in here, This is the serratus and also the cutaneous trunci muscles. These are all quite easily irritated, and he's not in pain. He's actually standing here quite happily. The other side of it is through the wither here, and he is quite irritated through the wither, and that if this has a saddle on it, this region, and it's irritable, then it's just going to tighten up and he's going to brace up again right through that area and right up into here. All service from the same vertebrae, which is, this is the shoulder blade. Directly under the shoulder blade here, the vertebrae, and the spine is coming down here and then up through here and up about that level. And this vertebrae or pairs of vertebrae here are not moving properly, and that's affecting the comfort of here and down here. So if we give you a quick run through the asymmetry of horses, this is a fairly abridged form, but it will give you an idea that it's a lot more than just, say, high heel, low heel syndrome. I think we've already mentioned that the first sign of asymmetry is a tendency for foals to actually take a preferred stance with one leg forward of the other. And the most common that is forward is the left fore, and that one is associated with wider lower heels most often, and the off fore, the one that's usually back, is associated with narrower higher heels. And this is part of the development of high heel, low heel syndrome in horses. And this is what we see in an adult horses, where we're getting greater height in one heel and longer toe and lower heel in the other hoof. This has been shown in warm bloods at least, that the greater the height of the wither, the more likely they are to develop this asymmetry. And the longer they are out on feed in the paddock, the more they're going to develop this sort of asymmetry too. The other thing that's commonly seen as asymmetry in horses is that the shoulders are uneven in horses. And I think this is mistakenly seen as one shoulder is bigger than the other. And most often it is, in my experience, the way the horse is leaning, whether it's leaning from left to right. This horse in the picture, if we pushed that horse over onto the left shoulder, pushed its weight more to the left foreleg, then its shoulders would even up dramatically, and you'd have a problem determining which was the bigger shoulder, because it's more prominent rather than bigger. Sometimes we see development too of deviation from the fetlock of the hoof as a result of this leaning, because if they're leaning to the left, that will change the orientation of the legs and will change the forces on the bone, and you get difference in the formation of bone, and you tend to get this tendency to deviate inwards, particularly on the left fore, and that leads to a paddle as the horse walks. And on the opposite side, you get that deviation turns this one out, and you tend to get a wing inwards as the horse walks away. And this fits in what is seen experimentally too. We see asymmetry with performance problems, and the number one is that horses usually have more trouble taking the right canter lead. They usually have trouble bending one way in particular, and most often they can bend easily to the right and have more trouble bending to the left. And they're quite often really quite tight down through here on the right side, and that is restrictive of their bending to the left. They have behavioural problems that go along with asymmetry too. They tend to be girthy, and they're more tended often through the girth on the right side. They're more likely to bite or kick that side if they're going to do that. And if you're girthing them up on both sides, usually it's the right side that they react most to. High kicking, or in this country it's called pig rooting, which people find a bit strange, but high kicking is very often associated with these asymmetries too. Bucking is a classic for it, particularly if they're tightening their wither from birth trauma. and dropping their back. They tend to be getting strained through the thoracolumbar junction, and so any pressure on the saddle seat area tends to lead to them bucking. But also girth pain and wither pain are a big one that leads to the bucking. And if you read the script here, the horse on the upper and lower right are the same horse, and it's only after one treatment of chiropractic to reduce the dysfunction in the spine that was associated with this bucking, and the horse changed dramatically, as so many do. Part of this is the pain and dysfunction asymmetry. I've already mentioned horses being more tender on the right side of the girth, and perhaps this is the main reason we mount from the left side. Not so much that we carry a sword or something in the past, but more that sticking our foot into the right side is likely to have worse consequences than sticking into the left on most horses. So perhaps that's the reason, and I really think it is. But about this tenderness of the girth and the dysfunctions that we see in the muscles and the skin, just an irritable sort of sensation, or it can go right through the whole gamut, right through to an extreme allodynia or a burning, knifing pain that they're experiencing. The muscles that are most affected, we've already talked about, I think, in the video, but the serratus ventralis and the long head of the triceps are ones that stand out. Also, the spinalis thoracis up in the dorsal side of the thorax is another one that really gets heavily affected, much more than the trapezius that's so often flagged. And it's much more that the spinalis is affected. And this is an offshoot of the longissimus dorsi, the long back muscle, and it attaches to the neck. Just a reminder about the pattern of rib fractures in foals. We see this the same with the dysfunction and mobility of the spine and associated nerve symptoms if we follow the nerve tracks where they go. And this really fits hand in glove with experimental work by Blythe and Kitchell and Blythe and Engel, or the distribution of the cutaneous nerves from the spinal segments. And it matches hand in glove with what we see with girth pain. I mentioned the spinalis thoracis. This is such an important muscle. If you look down here on the right side, you can see this muscle here in the schematic. This muscle is boxed basically between the skin surface and the bone. These muscles are padded by muscle. This one cops all the forces coming in from the skin surface to the bone, and it's incredibly important with the saddle. Too many saddles put pressure on this muscle up high in the wither and creates so many problems in my practice for horses. And tighten that muscle. And that in itself leads to a tendency for the neck to be pulled in and create a posture commonly called U-neck. And it also jams the neck vertebrae down in a more vertical pattern, and it goes along with fear posture for horses. This all does the same sort of thing, and that tends to stress the joints of the lower neck, straining the joints, causing enthesial strain there, causing enthesial strain of the muscle attachments there, and pain and arthritis of the joints. And also ganglioneuritis is likely, that is seen in that area, is likely to be a consequence of this. The other thing that the tightening of that muscle does, and the pain in that muscle, if you've got pain there, the horse is going to tend to drop its back and brace itself. And that creates drop to the spine and poor posture. It disengages the abdominal muscles that support the core of the horse. And if they're disengaged by pain from these muscles and it's exacerbated by a saddle, then things are just going to wind up. So you can do all the exercises in your world to try and get the horse to lift its back, but it'll never happen until you get rid of the pain in that area. We'll demonstrate this in a video for you in a second. This Galloway's a new purchase for the owner and has come with some problems. He's
posture in general. You can see how he's dropped through the middle of the back and is a bit peaky in the rump. And if we look more closely, he's very tight in the neck and has got some arthritis there, which is really common in association with tightness through the wither. Tightness through the wither area has been part of what's caused him to drop through the back and then put too much pressure on this region. So he's got some evidence of strain and kissing spines along this area through where he has pushed down the back. Where I've got a circle there, we've lost muscle. We've got muscle atrophy. And as a reciprocal of that, we've got spasm through the loin. And this often happens where they've got dropping here, the back has got to actually seesaw and make up for the fact that it's down here by going up here. Otherwise the pelvis has trouble connecting to the body. So we've got spasm of the muscle in this region, and we've got some pain associated with interspinous spaces here, as well as lumbosacral. This is all too common. It's very treatable. The soreness that's really contributing, and I don't know whether you can see him ducking away from my fingers on the other side, is particularly soreness down through the wither and down through the girth, which he's got on this side, but particularly through the wither on the other side. And this is typical of what I call right-sided birth trauma pattern.
Just a quick mention of flexure contraction and hoof asymmetry in foals. This, I think, in situations where they're in studs where a lot of foals are delivered by people, there's a lot of assistance of the delivery of the foal. I think this really ramps up the number that get this upright effect and also get this asymmetry of the hooves in horses and deviations as a result, and the need for knee strips and all those sorts of things. This was one study that was done in Britain by a group of farriers, and it showed very clearly that things were quite asymmetric, that we had a lot more trouble with the high heel on the right and a lot less on the left. And that's another part of the asymmetry that we see. And this contracture of the muscles and tendons is really concentrated on the deep flexor as being the biggest problem. But some seem to forget that as far as the passive stay apparatus, the triceps is a big part of that. And if the triceps muscle is held tight, it's going to contribute to tightness all down through the back of the leg and contribute to this more upright stance. What can we do to reduce the effect of birth trauma? It's pretty clear, I think. We've got to create a quiet, secure area for the mare. It's well known that a birth is dominated by the parasympathetic nervous system. Heightened awareness, or even subtle lift in awareness, that you may think you're just hanging around just from a distance, but you're actually still got to be disturbing the mare. So often people are watching their mare overnight and the mare seems to be about to foal, but you hang around and she doesn't foal, you go in for a coffee, and the next thing, as soon as you've come back from the coffee, there's a foal on the ground. This is not a good situation. That mare is foaled quickly because you've disappeared. You thought you weren't upsetting the birth, but obviously you were. And this anecdotal situation is just so common that I hear from people in the stud scene, people in the home scene of delivering mares. We've got to leave them alone. We want to observe them. If you want to observe them, there are now techniques you can do from a distance, and one of the ways you can observe them visually is by using infrared cameras and monitor from a distance. Don't be near them. Make sure that they've got a quiet environment. The other thing is, if a mare starts foaling, the foal's head and legs are coming out looking fairly normal, don't rush it out. Don't go trying to pull it out. Let it happen so the foal can expand the birth canal progressively. Don't make it rush through the birth canal and have that birth canal just squash it dramatically. The less hurried it goes, the more likely it's not going to suffer as much birth trauma. What can we do to help after birth? We want to reprogram the nervous system, and veterinary chiropractic, osteopathic and acupuncture therapies are one of the mainstays for this. We also want to help overcome compensations in the fascial and myofascial tissues. So fascial release work and myotherapies can all be part of this. And the work of Dr. Ricky Shields and Fabrica Elbron on fascia are really very critical to this, as well as other myotherapies. Straightness training can be part of it, but there's no good, you're not going to get the real advantage of that until you actually settle everything else down. So if we think about birth trauma, girth and wither pain and asymmetry and all these things, if we go past considering the concept of birth canal trauma as just being a novel idea, embrace it and start actively rehabilitating foals from an early age, my ideal is 1 month old, then we have the potential to change so many of the challenges involved with the humane use of horses. Being proactive about rehabilitating foals has the potential to reduce development of asymmetry from an early age, reduce pain and distress of horses, reduce one of the drivers of poor posture, reduce behavioural problems, reduce compensatory strain and arthritis from uneven limb use, make saddle fitting so much easier. We'd have quicker and easier training of horses, lower training costs, less veterinary bills, happier horses, happier horse owner relationships, all just things that we all desire. Personally, I've been seeing huge benefits from proactively addressing the consequences of birth trauma year on year. As horse owners, but also as veterinarians, chiropractors, physiotherapists, osteopaths and allied body workers, we need to be well aware of this issue of horses. As those in the front line, we have a huge role to play in addressing this issue from birth until death. Thank you very much for your attention, and I hope this was enlightening for you, and I hope this helps you change horses for a better way.